Hi friends, welcome back to my channel. Today I'm going to share with you 5 top tips on how to pass MRCP PACES. For those who are new to this channel, my name is Chris and I'm a doctor working in Glasgow, and on this channel I share videos on life experiences working as a doctor in the UK. So I passed my MRCP last year, which is one of the toughest examinations that all medical doctors need to sit through. For those who don't know, MRCP is a professional examination that all medical doctors need to pass in order to become a medical specialist in the hospital. So it is divided into 3 parts, and the last part being PACES, which stands for Practical Assessment of Clinical Examination Skills. This is, to a lot of people, one of the hardest examinations to sit through, as the pass rate is around 50 to 60% each year. So I myself personally struggled with preparing for PACES as I didn't quite know what to prepare for exactly. So on this video, I'm going to share 5 top tips I have for those who are preparing for PACES this year. So number 1, scope the subject. So this means understanding the subject as well as knowing what the examiners are looking for. PACES is divided into 5 stations, and for UK examination, stations 1, 3 and 5 are broadly grouped together to form a mini carousel, whereas stations 2 and 4 are grouped separately to form another mini carousel. For non-UK sites, all 5 stations form one carousel. So this is going to change for 2022. But for the purpose of this video, I'm going to focus on the current format. Stations 1 and 3 are examination stations, and they cover the specialties respiratory, abdominal, cardiovascular and neurological specialties. So you get 10 minutes for each station, 6 minutes to examine the patient. The examiner will give you a 5-minute warning, after which you get 4 minutes to present your findings and answer any questions. So for stations 2 and 4, they are the history taking and ethics scenarios. So they are both 20 minutes long, and you get 5 minutes for reading the scenario before going into the station. You then get 14 minutes to take a history or communicate with a patient or surrogate in an ethical scenario. 1 minute will be given for reflections, and this will be followed by 5 minutes of Q&A. So these stations are now run remotely in the UK, so it is important for you to be familiar with communicating over a video platform. So the last station, station 5, consists of 2 clinical scenarios, each lasting 10 minutes. You get 5 minutes before the station to read the 2 scenarios. For each case, you get 8 minutes for history taking and examination, followed by 2 minutes for Q&A. A 6-minute warning will be given for each case. As you can see, you are given time 5 minutes each to prepare for the cases in stations 2, 4 and 5. You'll be given pen and paper to write down your notes, so make sure you use the time wisely. What I usually do is I write down my differential diagnosis for the presenting complaint, as well as the important things to ask and do before going into each station. By having a list of differentials, you will be able to narrow down the diagnosis by working your way through to exclude important ones. So next, it is important for you to familiarize yourself with the examination sequence. You know that for stations 1 and 3, the examination sequence will be the same no matter what case you are given. So I highly suggest you start practicing by making sure you are able to do a focused examination of all 4 systems within time. So I would recommend starting off by examining normal patients, your family and friends, so as to familiarize yourself with the examination sequence. You need to do it so much so that during the examination day, you are so familiar with it that it becomes second nature. The only thing that you need to be thinking of during the examination day is to identify physical signs, interpreting them to find a diagnosis. You simply don't have the time to think about your next examination step. Even for other stations like stations 2 and 4, it is quite important if you have a skeleton structure so that you don't miss any important points to ask in history taking. And as for station 5, there are a few common cases that typically come up, so it is quite good if you have some kind of examination sequence to think about. Besides this, another key factor in passing MRCP PACES is to be able to organize your thoughts and present them in a clear and succinct manner. This shows that you know what you are saying and makes you look confident even though you may be trembling underneath. Also, as there isn't a lot of time in MRCP PACES, if you keep on rambling on and on about your physical findings, The examiner won't have the time to ask you important questions like investigations and management, which mean you won't be able to score high marks. If you're anything like me who isn't comfortable with presenting thoughts spontaneously, it'd be quite good practice to start writing down important key points for your presentation of common cases. Some candidates prefer saying the diagnosis first before summing up all the clinical findings, whereas other candidates may prefer a more systematic way of doing things, starting from peripheral signs, then moving on centrally before commenting on the differential diagnosis. In any way, it doesn't really matter as long as you have a system in place for presenting to make you sound comfortable and confident. And here is one example when presenting ADPKD. So if you have a consultant who is also a PACES examiner, it would be quite a good idea to ask them to see if they do any PACES teaching. By doing this, you get a feel of what they are looking for, as well as the common cases that you get asked during PACES. So I know that you can be asked literally about anything in PACES, but depending on where you're sitting for PACES, there are common scenarios that typically come up for each station. So you can get to know them by asking your colleagues what scenarios they had for their PACES, looking through online resources or books on common cases typically asked in that region, as well as getting an idea of what kind of illness or diseases that are commonly seen in that place. So just an insider tip, actually finding patients for PACES examination is actually quite a challenging task. You need to find patients who are relatively stable to be examined during PACES. So a lot of patients who are either unwell with sepsis, with cancer, they don't tend to get selected. Patients with more chronic conditions like well-controlled diabetes, thyroid, and even Parkinson's tend to get selected for PACES as they generally are managed as outpatients and can turn up to the examination hall. You may get the occasional sick patients from the hospitals if patients don't turn up or if examiners are struggling to find patients. And finally, the last tip is practice, practice, practice. Find a friend or buddy who you work well with and can practice together. This will make preparing for PACES less strenuous and can actually be quite fun when you practice with someone you work well with. Books and online resources are good as they set a direction in which you can study, but they cannot replace examining real patients with physical signs. A lot of UK candidates fail in PACES because they fail to identify physical signs or made up false signs. What I did was I practiced with my friends, examining real patients under timed conditions, and we also got in touch with our senior colleagues who have passed PACES themselves to supervise and examine us as though it is in a real examination setting. And finally, here are some of the resources that I've used which helped me pass PACES. So Cases for PACES is a quick read with brief overview of common medical conditions that typically come up in PACES. Another book is Pocketbook for PACES, which is more detailed compared to Cases for PACES. It is ideal if you want to know more information about a certain condition, but I have to say you don't really need to remember everything in the book because there is simply too much information. You just need to know the important salient ones. I've also used Clinical Medicine for MRCP PACES Volume 1. This is good if you want example of case presentations. And lastly, I've used PASTEST, which has good videos that take you through model history taking and focus examination on various medical conditions in PACES. Thank you for watching this video. I hope you find it useful when it comes to preparing for MRCP PACES. If you'd like to know more about MRCP itself, please check out my other video on this. Thank you for watching once again and see you later. Bye bye.